I'm Amber Tresca, and this is About IBD. I'm a medical writer and patient educator who lives with a J-pouch due to ulcerative colitis. It's my mission to educate people living with Crohn's disease or ulcerative colitis about their disease and to bring awareness to the patient journey. Welcome to episode 166. People with IBD may have abdominal surgery to treat their disease. Unfortunately, that comes with the risk of developing a hernia, which is a weak spot in the abdominal wall. Organs or tissue in the abdomen may push through it and cause symptoms. Peristomal hernias after ostomy surgery are especially common. Today, I'm once again joined by my husband, Mike, because he recently had robotic hernia surgery. We discuss his experiences, including how he discovered that he had a hernia, the diagnostic process, the actual surgery, and his recovery. Mike doesn't live with IBD, but his experiences will be helpful for anyone who is considering hernia surgery. One programming note that I want to make you aware of is that we discuss returning to intimacy after having surgery. We don't get specific, but we are a married couple, so if that's something you want to skip, that discussion begins at about the 1 hour mark and goes for about 8 minutes. All right, on to the show. Mike, welcome to About IBD.
I'm back. Did you miss me?
Well, in order for me to miss you, you would have to go away.
Well, your listeners miss me. I've only been in 2 episodes, so this is my third.
Has it only been 2? Are you sure about that?
Pretty sure. Okay. I remember them well. We've had the second one was quite the doozy, so yeah, I'm pretty sure.
Okay. Yeah. I thought it might be more than that. All right. So this is number 3. I was thinking it's almost like once a year. Not quite, because the show has been going for longer than 3 years. But the last time was last year when we went through your colonoscopy journey. And we talked about what that was like for you as a non-frequent flyer.
This is the 4th one then.
Okay.
Yeah. I completely forgot about the colonoscopy one. So this is the 4th one.
Oh, okay.
Yeah,
all right.
Yeah.
Okay, so let's level set for our listeners first off. Mike, give a brief introduction as to who you are.
I am your loving spouse, and I also am a gamer. I've been working in corporate America for 25 years. That was our work anniversary, and our wedding anniversary is in a couple of days. So happy anniversary, my love. But my day job is mostly marketing communications. So I do a lot of engagement on social media and the web on behalf of a Fortune 100 company. So yeah, that's me. Does that help? Is that enough?
Yeah, it does. All right, Mike, I did invite you here today with a specific purpose. And that was because last year you had a colonoscopy unrelated to what's going on now. But this year you had another situation in that you discovered that you had a hernia. And so you had hernia surgery a few months ago. And I thought it would be helpful for listeners to hear about what that surgery was like for you, because it is actually it's pretty common in general. And then it's fairly common, especially for people who've had abdominal surgery, which you have never had anything before, right?
No. First of all, I was lured here under false pretenses. I thought we were going to talk about horror movies. I'm on the wrong podcast.
We're not going to talk about horror movies today.
No, I knew I was getting into. Yeah. So, So did you want me to just sort of describe how we got to this point, or what would you like to know?
Well, I'll feed you some questions. That's usually how this works.
Oh, okay. Yes. Podcasting. That's right.
Yeah. So let's start first with how you discovered that you had the hernia, because it was you that found it, and then you had to proceed on to getting to engaging a healthcare provider in order to treat it. So tell me how you found it and what that felt like.
Yeah, so I do lift weights. So there's always a concern that you just don't want to push yourself too hard or potentially hurt yourself. And wearing a belt after weightlifting. So I wasn't wearing a weight belt, but I was just when I wear belts for work or during the day, I started to notice that it was chafing, and that's new. So, and then there was sort of puffiness sort of in that area, above the groin. So, and it's one of those things that I feel like we even discussed it. It was like, you couldn't see it, but I could feel it for sure. So I have a physical with my general practitioner every year. We got into that habit, which was good. I should be doing it anyway, but we got into that habit because I would often have to have physicals for camping with scouts. So I had the opportunity to sort of see him, and I brought it up, and pretty quickly he told me, "Yep, that's a hernia." So I had suspected it wasn't painful to start, but certainly I started to notice it, and I was like, "Yeah, this feels like maybe that's what happened," and then he confirmed it.
Okay, so what did it feel like, though, when you sort of touched the area yourself? And then what did he do to confirm that it was a hernia?
It's a lot, it's a lot of touching. So you sort of, it's puffy. And then, and the other thing that would happen is it would sort of be worse on some days than others, which was always fascinating to me. So like some days I'd be like, oh, it's gone. It doesn't feel like that. And other days it definitely was. And of course you're concerned it's something else, right? So I was always like, I don't know what else it could be, but I didn't want it to be something problematic. So for a little while, I was trying to convince myself that it wasn't there because it would come and go. But basically you would feel it and it was puffy. It didn't hurt. But it didn't felt like it belonged there. And it was, and again, the other thing is there's two sides, obviously. So it seems a little elevated on the one side, right? So I was like,
two sides on your abdomen.
On
so
my
you're saying
abdomen,
your
right.
abdomen didn't, one side looked different than the other.
Correct. So you could compare and contrast, right? So so that's how it started, where I was like, this doesn't seem typical. And then he did the same. So he touched, and within a few seconds of just examining me, he said it was an inguinal hernia. So I was like, oh, okay. So it wasn't just my imagination.
Right. And then he recommended that you go and get more care and have somebody else look at it. So what happened next?
Well, it was interesting because his response, I love my doc, by the way, was, everybody gets them. You're at the age where you'll get them. There's not something you did wrong, which I thought was interesting. That's the first thing I asked was sort of, did I do this to myself? Was there something I did in particular, because I left weights, that the concern was that I had overstrained. And I still don't know that that's not the case, but he was like, it happens quite frequently for lots of reasons. It's not tied to a specific thing. But he sort of said, that you can have surgery to patch it up if you want, but it's really not a crisis. And he was really very clear on that. He was like, it's not a big deal, at your own pace. Whenever you want to deal with it, it's fine. You don't have to get it, like, it's not like it's dangerous or life-threatening or anything like that. And I appreciated that. So I definitely asked for a referral, which he gave. And I knew it's not a quick surgery. So there was a lot of other complicating factors just to get all this right. But it was good. It put me on the path. So yeah, he did not, there was no urgency. There was no concerns. He was just saying, if this is something that bothers you, we can have it taken care of, and here's who I'd recommend. And he did. And that was probably what appropriate, other than which we'll discuss more down the road, what we discovered. But for the short term, he basically said, you don't have to get it taken care of, but if you want to, here's a surgeon you can see.
Right. So he did send you to a surgeon, and then you went to see her. Now, I wasn't with you for any of these initial appointments. I was with you later on. So that's why, I only have your point of view to go on here. So you went to see her, and she also confirmed, right? She palpated your abdomen again, right? So what was that like?
Different. Right. So whereas my doc sort of patted and was like, yep, that's what it is. She was like, first of all, which I thought was interesting, she said, thank you for coming to me. She said, I work on this frequently. I will tell you right now that I have had to essentially put people's organs back in their bodies because their hernias have been very, very serious. I am glad, while you are younger and healthier, that you are addressing this, which I thought was that got my attention. It wasn't hey, business as usual. It was very much, I'm glad you're coming to me about this at this point in time. It's important we take care of it. And I'm glad. So there was a little bit of a different tone, right? That was the first thing, which was different from my GP. So, which was fine. But I paid attention from that point. And then they have to put a finger sort of up and under into your body. So she said, let me test. And that was somewhere in the middle there. I sort of said, I could have two. Sometimes I feel it on the other side, and that was new. I hadn't always felt that way. And she said, well, two things. One, she said, definitely you have a hernia. Not a big one, I don't think, but you have one. And she said on the right side. And she said, if you have one on the left side, we will take care of it. You get 2 for the price of 1. And it'll be taken care of. And then she explained that there's a robot, which was always funny. The robot conversation is hilarious because she's like, it's not an AI robot. It's a human-assisted tool. And I was very excited to meet the robot. That was the highlight of this. So, yeah, but the short of it was, she explained the surgery itself, which was essentially there were 3 incisions. It involves inflating your abdomen. They put mesh in. The mesh sort of, I guess, unfolds. I'm not sure how they get it through the holes there in your body. I assume it sort of expands or unfolds. And she's like, and then you have that for life. And that will reinforce essentially your abdomen because this kind of thing happens to people as they get older. She was like, it's a very common surgery, but I recommend it at your own pace. And again, sort of that same, not urgent, but good to do. And we made an agreement that basically we weren't going to do it for months. We had vacation coming up and a lot of travel, so we just weren't going to do it right away. And I couldn't schedule it. That was the other challenge. I couldn't schedule it that far out. So I had to call and try and schedule it later. But that's where we left it, which was, yep, definitely at least 1 hernia, possibly more, not very large. And we, when you get the chance, schedule it and we will get it done. As always, I hesitate to call it outpatient. But the idea being you're in 1 day and you will absolutely have to rest. She did make that point for a week at least. And for a month, won't be lifting anything. And then we would take it from there. So we didn't get into too much more detail because obviously as we got closer, we would have that discussion. But she definitely put me on the path of surgery for sure.
Right. And so then you did decide that you wanted to proceed. Mm-hmm. And then it was just a matter of trying to get it scheduled. In between, I think it was the spring when you discovered it and that, these appointments took place then. And then, of course, during the summer, we wanted to have a summer. We had things planned.
Be nice.
We had a big international trip planned and then also camping and things like that. So we waited until the fall for you to be able to have this surgery. And I wasn't in any of these initial appointments with you. However, working in the space as a medical writer and a volunteer, I've learned a little bit, totally not in relation to your situation at all, but learned some things about hernias and hernia surgery and the robotic surgery. And it was interesting because it was explained to me by a surgeon. And I've seen pictures of the robots. I've never seen the real live robot. I've just seen the photos.
I have a story about that. I don't think I told you, but we'll tell you.
Oh, yeah. Awesome. Yeah. Great. I love a reveal. And laparoscopic, which is amazing, that's the 3 small incisions versus the 1 big one. Mm-hmm. And that's pretty much all I knew kind of about your specific case at that time. And then we scheduled it. Now, what was kind of bonkers to me was that, as you said, it literally is outpatient surgery. So you're in that morning, they do the surgery, you go home that afternoon or that evening. So we understood that that's what was going to happen. I had reservations, concerns. You had some as well. Tell me about what your biggest concern was in this whole process.
1 word, pain.
Yeah.
I can't imagine I'm alone. Some feels like I was kind of whiny about it, but I feel like any person in this situation is concerned about pain first and foremost. They sort of get the other stuff. I had a lot of conversations with practitioners and assistants and other staff talking about all the other prep. But by far the thing I cared about most was the pain. And that was the least conversation we had. So that was really the big question. And related to that was, okay, how much pain am I going to be in to be able to operate? Right. So in other words, and by the way, this is of course tied to your pain killing situation, that pain management. So how are we going to deal with the pain? Because that affects other things. For example, going to work. And I really couldn't get a straight answer for a bit about how quickly I could go back to work. I had always assumed a week. And the good news was I work remotely. The bad news is working remotely or any desk worker just basically sits crouched. So there's certainly unless you're laying flat or something, which you could potentially do or stand, it's a lot during the day. So there was a tolerance limit for that. But what I essentially landed on was how much pain medication will I have duration-wise? And that's going to dictate how long I should be out. And that's sort of what led the conversation, because I couldn't get a straight answer and I needed to carve out the time appropriately. We settled on a week. I think the surgery was a Monday or a Tuesday. So we essentially settled on the rest of that week. That was through conversations with the practitioners. That got complicated because implicit in that conversation was that's how much medication I was going to get. And that's not how it works, is how the surgeon at some point had to explain to me, which was it was at her discretion. And that spiked my anxiety, partially because I was not clear on how she was going to make that judgment call. So that, in other words, the idea being, we're not going to send you home without any pain medication, but we're not going to send you home with a week's, and we're not going to tell you how much you're going to get, because we're going to make a judgment call at some point. Now, the question, of course, is, when does that judgment call get made? Because, of course, my situation is having been through surgery with you and been through a while ago some other surgeries. It's really interesting. Like, I'm not in pain while I'm at the surgery point, right? So in other words, there's no clear, like, oh, I'm in pain, you have to give me meds for the rest of the week. So I was a little bit like, who makes this call? The surgeon does, I guess, and based on what evidence? So I think what was implicit and not said was, depending on how extensive the surgery was, that was going to change the meds that I would be getting. So in other words, it wasn't really tied to my pain. I wouldn't be expressing pain one way or the other. There was some variance in how much the surgery could be, which again, I didn't really fully understand. So there was a lot of discussion, to the point that I was anxious enough to say I wasn't going to do it if I didn't get assurances. And to my surgeon's credit, she did call me and reassured me that she absolutely would. Basically, I have to trust her, but she wasn't going to give me no medication, and she would give me the appropriate amount, which, of course, I had no idea what it was. So we had to take a leap of faith. But at this point, I was a little bit like, if you're willing to go under and have this person working with her pet robot to work on me, I got to trust her the rest of the way. So I made a decision and decided to do the surgery.
Right. And I also was concerned because there is now a trend towards sending people home and telling them that they should take alternate acetaminophen and ibuprofen, and that they'll be fine with just that. My experience with colectomy and J-pouch creation was that I needed at least 2 weeks worth of pain management. After I got out of the hospital, and I was in the hospital for 5 days, and I don't think either one of us has a low pain tolerance. I myself can't do the ibuprofen anyway.
Right.
So that was what I was basing it on as well. And so I was also concerned that I was going to end up like making some phone calls and trying to get your pain medication filled or refilled. Meanwhile, you're already in pain and behind on the pain because you have to stay ahead of it, and then trying to manage it, all while trying to manage a household because, you, of course, are not available to do any of that, which is fine, unless you're trying to get something done really quickly like that. And, having another adult around would be helpful. So that was the biggest concern. I remember we went through several days where there was some back and forth with your surgeon's office. And then she finally called you. And like you said, you agreed. And then we were able to set the surgery date.
Coming up, how Mike prepared for surgery.
I don't remember this actually at all, which is bad, but there really wasn't much of a preparation for the surgery, right? It was kind of a stop eating after midnight type of deal.
Yeah.
Right?
Yeah. Most of the concerns were just like making sure you're not taking any kind of protein shake.
Oh, and stopping meds.
Right.
Yeah, stopping
your medication, stopping whatever your
supplements.
intake was, and then don't eat. Don't be a gremlin after midnight kind of thing. But but pretty much beyond. And also, like, come in comfortably, be ready for surgery. And the surgery got moved, right? It was originally going to be very early in the morning, and that was going to complicate things. And then it turned into afternoon. So it had shifted to the afternoon. Again, not a big deal. Then you start to get hungry, right? Because you're not supposed to eat. So, we're always trying to do morning stuff. But it was fine. I mean, there was just, at that point, I was not in the mood to do anything or eat anything. So it did shift a little, but mostly, yeah. And this is my point. The amount of dialogue I had about prep far outweighed the amount of dialogue I had about pain. And pain is what I cared about most. And a lot of times the prep was overlapping. So I had a conversation with several different people, or I had forms I had to fill out, and they were all sort of saying the same kind of story, which, by the way, it seems like the surgery of this type has advanced quite a bit. So every once in a while, there would be things that seemed outdated that were still in the paperwork that they gave you. So that was the other thing, too. We were like, well, which is it? What am I actually allowed to do? What can I actually do? Near as I can tell, the state of hernia surgery has advanced pretty strongly in the past 5 years. So a lot of this stuff isn't true anymore as much, doesn't apply as much in terms of what you're allowed to do afterwards. And that was part of the problem. I couldn't get straight answers out of folks because it seemed like they weren't 100% sure. And presumably no one's sure except the surgeon. And she's only sure, as we discovered later, when you're actually on the table. So we just didn't get sort of a lot of clarity on a lot of this stuff. But yeah, I mean, in terms of what you prepared for, you kind of just showed up to the hospital.
Right. So, all right, we get everything's all set. You have your pre-op appointments. You stopped your supplements that you take, your vitamins and whatever. Mm-hmm. I don't even know everything that you take.
It's probably for the best.
So you stopped all of that as you were supposed to. We went in the day of the surgery. You get prepped. They take you away. And tell me what that was like next from your perspective when they wheeled you into the OR. I do believe that they gave you, what did they get? They gave you something. Was it Valium or something before they wheeled you into the OR?
Yes, I don't remember what it was. I remember the
anesthesiologist
visiting and talking about potions, which I thought... I think
I know. I was a little bit
don't
like,
call them potions. You're making it sound like it's
I was
magic.
a little bit like, can we use the real terms because we will understand those things.
He was attentive. Everybody was actually lovely.
Yeah. But I asked him to tell me specifically what medications he was giving you, and I got the impression that he does not normally get asked that question or give out that information. Yeah, and I was like, no, I don't want to talk about potions. I want to talk about exactly what you're giving and when.
I mean, this is a point that I think it's worth for listeners. To me, it was very interesting. It's clear to me that hernia surgery tends to be an older person's. Look, we are definitely older, but much older. So there's a lot of things that I think happen that just sort of click along and nobody says anything. And it's because there's an assumption that these are older folks who are maybe not in a position to push back, not in a position to ask, or not in a position to advocate for themselves. So
but that's pretty bad then. I
agree. I don't think that's great. But I mean, the pain conversation seemed to catch people by surprise, where I was like, I have enough agency that I will not show up to your surgery. Because even though you've decided, because, everything, once they schedule, they just want to click it along. And the same thing, right? That was the sort of an example. Asking questions seemed to surprise everybody, right? Because this was definitely a process. So, but to your question, it was mostly, the first thing is always like, how naked do you get and how much stuff do you take off, right? That's always a concern. You made that point, got to take your wedding ring off. I mean, like literally, like you're like, what is it? Because they tell you to take everything off, and you're like, oh, there's things I don't even realize are on my body that could swell up or whatever. You want to make sure you do. But like you said, certainly they gave me something to calm me down, I guess. I don't think I was expressing anxiety, but they're like, it just makes it easier. And then there's a gas when you get in there. But they were very sort of, moving along. We met different people who helped us, talk about changing clothes and just preparing and putting your stuff away. So you put your clothes away. Again, you're not going to have anything, right? So you're sort of just there. And which is interesting feeling in this day and age, right? No phone, no watch. You're not even wearing jewelry. You're just the naked the way you came into the world.
It's just you and your hospital gown, and that's it.
Yep. So, which is fine. I've gotten better. I think it's harder for men. I think, as you've said before, women have to deal with a lot of these things just because of the nature of examinations and the medical visits you have. For men who either don't go or don't go through this, it's different. But I'm a little bit more socialized to it now, so it was okay. The fun part was they brought me into the room and I saw the robot, and we had a whole hilariously awkward dialogue where they didn't want to tell. I was like, "Does it have a name?" And they were like, "No."
Does it have a name?
And they were like, and they all looked at me and were like, "No." I was like, "Why not?" And I'm high at this point, right? And they're like looking at me and they're like, "Do you want to name it?" And I couldn't come up with a name because I was slowly losing whatever grip I had on reality at that point. But it was a pretty funny thing because they were like, "That's the robot." And the robot is this giant, like, I don't even know how to put it. It looks like an industrial.
It's really, really big.
Yeah, it's enormous. I mean, it was funny because I didn't think of it, but yeah, it makes sense, right? It's got to be over you. I mean, it's almost like its own operating table with sort of its arms to do the work. And it looked like it had 3. I don't even remember. Now I'm sort of dimly remembering. I should probably look it up on the internet as to what it was. But I wanted to call it Bob or something. I don't know. But they, I feel like it has to be alliterative to like Harry the Hernia bot.
I don't know. You want to call it like Slice? Stitch?
Stitch. No, something friendly and not terrifying. But yeah, like Harry the Hernia bot or something. But anyway, that was it. I always, it's funny because every time I do this now, I say, "Do you want me to count down?" And they laugh at me and they're like, "No, why?" And they're like, "You can if you want." And I remember trying, I do that. And of course, then you have got the mask over your face and they can't hear you anyway. I think that's part of it. It's different. So I try to count down and I never make it. So yeah. And then I was out.
Yeah, they did used to ask you.
Yeah.
They did used to ask you to count down. My last pouchoscopy, the IV was not in properly.
Ugh.
And so the anesthesiologist pushed the propofol. And I looked at him and he's pushing it. And I said, "All right, good night, Irene." And then nothing happened.
Oh, God.
And I turned to him. And a few seconds later, I turned to him and I said, "Well, I'm still awake." And he goes, "I noticed." And they had to place a new IV. So, I mean, it's, the countdown thing, nobody asks you to do that anymore. But at the same time,
it serves a purpose.
It can serve a purpose.
You want to know that you're out and you want them to know that you're not out if you're still
right. Right. So that was just a funny thing that happened to me. But back to you. Okay. So you're in the OR. Now you don't know anything. You're having a long nap. I was in the waiting room and then I went and got some great hospital cafeteria food. And I forget how long they told me it was going to be, but the timing was going on far beyond what they told me that it was going to be. And I also knew some other things in terms of that you were her only case that afternoon, things like that. So it was going on a little bit longer and I wasn't worried or anything like that, but I was like, okay, something either didn't start on time or, something was different. So she came out to talk to me in the waiting room, and she told me that, yes, you had the one hernia, and then she found another one on the other side, and that she repaired that one as well. So, and then a while after that, obviously they brought me back to see you. So what do you remember of that, if anything?
Well, and it was sort of what I suspected, right? So you come out and you have the ability to request drugs. I don't know what it is that I was getting. Eventually, the surgeon did come to speak to me. It was supposed to be 3 hours. So that's what they had said originally. It ended up being 5 hours, I think, or in change. But it was more than 3. It wasn't 3 because we knew I actually had it all scheduled and knew when I was supposed to come out. And it didn't. That's not how it went down. So that was the first thing, was clearly this took longer. The second thing was we went from one normal, air quotes, hernia on the right side to 2 presumably large ones. And I think she made that statement. I'm not exactly sure where I remember that being said, but it was like 2 large ones. But which again, the first thing you could say is, geez, did I do that? But yeah, so 2 large hernias, and obviously the surgery took longer because of that. And Harry, the hernia bot, had some work to do. So that was taking longer. And then they want you to be pain-free. I asked for all the pain meds I could get the whole time. And they gave it to me, which I thought was interesting because there were people who I felt like were potentially not going to be given them. And they just were like, you get whatever you want. So that was this first where I was like, huh.
Because it was more extensive
right.
than initially anticipated.
Right. And then the rush to get you out begins, which, I'm not unfamiliar with this, but it kind of aggravates me. And then it was like, okay, you need to pee, right? That's the big thing is you need to pee. We want you to pee because if you can pee, you can basically that's your exit plan. So they were pretty tolerant. I was there for a bit and there were people coming in and out, all in various states for their whatever surgeries. But they were definitely getting ready for me to sort of go to the next stage, which was to get me to pee because if I could pee, and by the way, you can't feel anything, so they're a little bit like, well, you're going to need to stand and you're going to need to go pee and we're going to hopefully see if you can do that. So they were sort of hoping I was able to do that. And then of course, then you're sort of, that is your launch to go home. So,
right. And they got you out of bed, right? They got you out of bed.
Correct.
And brought you to the bathroom.
But I was able to do
that. You were up and walking.
Right.
Within an hour after surgery.
And they were like, great. Okay. Now there was a conversation with the surgeon. And of course, as I've said before, and I said to her prior, you're going to talk to me. I am not going to understand and remember everything that you said. And that's how it went down. I think you were there for that dialogue. I hope. I don't remember. Were you there in the room?
Nope.
No. Okay.
Nope.
So this was
She came out and talked to me. You and her and I were never in the room.
So we had to compare
together.
notes, which is not ideal. But she basically said something along the lines, and again, I don't trust my memory. I was high out of my mind at that point, but it was a little bit of, you may get some shoulder pain from gas.
Right.
It's referred pain. I heard the word shoulder pain, weird. I heard the word gas, like, yeah, of course, because they said you'd use gas to sort of inflate your abdomen to do the surgery. I really didn't understand the implications of any of what was said. And that was all I got. I did get that there were 2 large hernias, so it was longer and sort of more of a surgery than was anticipated. Nowhere was it said, so by the way, the pain's probably potentially more challenging because you had, and I still don't know if that's the case, but it was certainly like whatever we had gone in with assumptions were not the assumptions we came out with. And that mattered later. So yeah, it was news to me. And I don't know how well I sort of understood what was happening, but I just knew they wanted me to pee.
Yeah, so you peed, then somebody came and got me and brought me back to you. And I think about this a lot in regards to myself and others, and then in regards to you as, we were going through this, journey together. Everything was all set. The nurses were explaining things to me, giving me the paperwork. All is fine and good. Okay, now he needs to get dressed. Now, and that was my job. Like, it was kind of funny because that was my job to help you get dressed while you were, under all of this pain medication and anesthesia, and you couldn't really feel anything. And I was like worried about you falling. Like, it was just kind of a wild thing that I was like, oh, wait, I have to do this, But we got through it. It's a lot harder to put socks on an adult than it is to put them on a child, and shoes. I will say that. Yeah. Like, obviously, I have 2 children. I have put, have babysat, all of this. So I've put many a sock on a child. It is not the same when you're trying to put socks and shoes and underwear on an adult. So that was kind of funny. So, all right. So we get you all set. Bring the car around, all of that. Get you home, get you into the recliner. Now, here's the thing, too, I think, is that we have a recliner.
Yeah.
Which, I don't know what the percentage of, people have recliner in their home. Like, I really don't know, that you would be able to manage it very well without having that. It was so much easier to just set you up in the recliner in the center of the house so that we could make sure that you were taken care of versus putting you in the bedroom and laying flat or whatever, and then not knowing what was going on with you. So I put you in the recliner and you fell asleep pretty much right away. Yeah,
and that was interesting because we were prepared for me to stay in the bed. And almost immediately we ended up doing the recliner and sort of all the plans changed. But to your point, no discussion. about any of that, which I always find interesting because, again, that's really important. How a person's going to be sort of not flat, not crouched over, but in between. And the recliner is really the only way you get there. So it was ideal for our purposes, which is funny because I think at various times we've wanted to get rid of that recliner. But
oh, I hate that recliner.
oh, not anymore. That's my best friend. That thing's going to be with me forever.
I know. I mean, it serves a purpose. It's useful. I just don't like it.
Yeah, I know.
So.
I know. Well, it old recliner came to the rescue because we needed it.
Yeah. All right. So then began the great tracking of the pain medication because what they told us to do in the paperwork. Okay. So then what I do, and I've done this for a long time, I know people have different ways of dealing with it, is that I literally just get out a notebook and start writing it down. So I'm writing down every time I gave you every pain med so that I could then space it out for the day and make sure that every 2 hours you were getting something so that everything was overlapping. It was, acetaminophen and then ibuprofen and then an opioid and then over again acetaminophen, and then it kind of went like that so that you weren't having too much breakthrough pain. Although on that first day, you were fine anyway because whatever they gave you for the surgery hadn't worn off yet.
Right. I did not understand that. That was probably the biggest thing, was just how much of a reprieve that first day was really the drugs from the surgery or while I was down in the outpatient versus the medication we were using. But yes, so seemed good first day.
Right. Yeah. And I was just, even though you were like, I'm fine, I was still giving you all of the medications because I knew just from experience that you just have to do that. I also know from experience that it is that second to third day where things really start to get tricky. So we were giving you the pain medications. It's a challenge overnight because you don't want to be waking up necessarily to have to take stuff if you don't have to. And I think I made the mistake of letting you sleep and not waking you up to give you pain medication in the middle of the night. And then what happened is that you wound up waking me up. And tell me what you were feeling at that point.
I didn't understand intellectually, like sort of in the back of my mind, I sort of got a understanding that there was referred pain from gas. The problem was I spiked a fever. I know sometimes it feels like, because, we checked it. We have one of these, touchless thermometer things that gives very variable results, but I felt really hot and the pain in my shoulder had gotten very, very strong. And then I started to have chills. And the problem was it was muscle pain, I thought, in my shoulder. So then the chills were setting off a chain reaction. So I feel like I have a fever. I'm shivering, and what felt like a vice-like grip from my heart, which would be my left pec to the back shoulder, was just convulsing in pain. I couldn't sleep and I couldn't find a way to move in a way that was going to help. And the medication we had, including the opioid, because we often say the opioid doesn't really remove the pain. It sort of makes you not care about it, which is subtle but important, wasn't working. Nothing was working. And I knew I was trying to wait till the next how long I had, and I couldn't anymore. So first of all, I was like, I'm very afraid I'm going to overdose. I'm going to take something I'm not supposed to take. I'm not in my right mind. Second, I am also afraid I'm either having a heart attack or a stroke for some reason, which didn't make any sense, right? Because obviously it was tied to the surgery, but you're not in your right mind anyway, right? So I was like, I don't trust myself. And then third, I felt really bad because you were asleep, you were in a deep sleep. And I had felt okay up to that point. So I was like, is it going to be, it's not going to be fun, but it's going to be relatively smooth. But that's not what it was. It was very much sort of this absolute sort of unstoppable over and over pain where I couldn't function. And I was like, we're going to have to call the emergency room. I'm going to have to go away in an ambulance because I don't understand what's happening. And that's basically when I woke you up.
Right. And then you were telling me I'm laughing. It was like, it's funny, but it's not funny because you were pretty convinced that you had pneumonia. And I was reassuring you, you do not have pneumonia.
Mm-hmm.
We got behind on your pain and it's not great. And you're having pain because all of the things that they gave you the day of surgery have now worn off. And then also the position that you're in while they're doing surgery and then the gas and all of that. So it was basically like giving you the next round of pain meds and then just sitting there kind of, and I was like, sit up, and we'll try to move this gas around. I mean, I know what that gas pain is like, having experienced it so many times, and it really just like feels like it gets under your ribs and you just can't get it out of there,
Well, it didn't feel
and
like
you
gas.
gotta walk around.
That was sort of
it doesn't feel like gas.
If you haven't had it before, you mean sort of, again, intellectually, she had said you may have shoulder pain. I was like, that is underselling the pain, number one. And number two, not what I would think of as gas pain. Right. So it was very, very different. And of course, this is not regular, air quotes, regular gas that they're pumping into you. Right. So it's whatever they're doing. It's very much I didn't even consider that until you just said it now. Who knows what position I was in? I don't know. Maybe I was upside down when they did the surgery. So I don't know where the gas would have expressed itself or whatever and how it would have traveled. Or, again, the nerves are reacting in one spot and the gas pain is actually somewhere else and it's totally referred pain. It doesn't matter. In the moment, it's just really painful. So, and it was in the middle of the night. It was like 2 or 3 in the morning. And we just had to wait it out.
It's always worse in the middle of the night.
Yeah.
That's the other thing. It's always worse.
Yeah.
So we basically just, continued with your pain medication regimen and sat up and watched, I don't know, something on the TV until you felt sleepy again and were able to sort of fall asleep, sort of halfway sitting up type of a thing. So, yeah, so that was a pretty bad night.
The other thing that was sort of in the moment was they were like, hey, did you know about this? And they bring out this little cup with a tube connected to it. And they're like, you're going to have to breathe into it. And I was like, what? And they explained, without explaining, as you explain later, they're worried about lung function. That stuck with me. And that was where the pneumonia comment came from. Because what's surprising, and again, not news to you, certainly news to me, when you're under this deep, well, there's a lot of things that happen when you're under this deep. First of all, the concern is you're so unconscious that your lungs are not functioning. And then, of course, now you're out of the surgery and you're taking these drugs, the opioids, and the worry about your lungs. So I knew I had lost lung function, and that is disturbing if you're not used to that. So, you try to breathe into this thing and you have to keep it at a certain level to essentially exercise your lungs. And I was weak as a kitten. I couldn't even do it. So that was surprising. And was sort of last minute.
And then I'm coming in every whatever hour or whatever. And I'm like, did you breathe into your thing?
Right.
Here, breathe into the thing. Because I know how important that is.
Yeah.
It's really important.
It is.
And it's an easy thing to just be like, ugh, I don't feel like doing that and not do it. But it is super important.
But it's also a way to show
that.
how you're not, you can get over the pain and convince yourself you're fine for a little bit.
But it's an objective measure to show you. You can't, you're not able to breathe. You're not able to suck in enough to move the little ball thing.
Right.
So you're not doing as well as you thought you were.
No. And then
basically,
the other thing that was never mentioned at all, and again, I just this is the stuff I care about, guys. I don't know what you care about, but I care about being intubated and I care about being catheterized. And I did not know either of those were going to happen. Both of those messed me up. So when I woke up out of the surgery, I had like a glob of what I could only describe as phlegm, but almost like mucus. It hurt to pee. No one had mentioned any of that. So that was another thing. I was like, well, why? I didn't even understand that I had been catheterized. And I realized it later. I was like, that's the stuff we got to talk about, guys. Not all this aftercare that just so I'm aware and prepped and not surprised as to what's going on. Because a lot of it was I was sort of almost like I was at a witness to my own crime scene where I'm trying to piece it together as to what happened to me when I was under. I didn't know any of that. So, yeah, I figured it out, though.
I think you said at some point you were like, my throat hurts. And I was like, yeah.
Yeah.
Okay. That's because they put a tube in your throat.
Yeah.
Yeah. And, you had a catheter too. So, and yeah, those are the things that are a little surprising. And it's funny to me too, because I didn't even think about it. That I was like, yeah, of course you're going to have that.
Well, and what's ridiculous for me is I haven't been under surgery. This is major surgery. Like, I didn't really understand it, but that's major surgery. Major surgery is, like you said, they like worry about all the functions working in your body while you were unconscious. And you have to be, this is to make sure you are okay when you come out of it. So I have obviously not been through major surgery. And this is what, some of the pieces you can expect from that, any surgery of that level. So it was a surprise to me just being my first major one.
Right. Yeah. And it was also a surprise to me that they do the surgery and then let you go home that day. I'm guessing that's because the majority of people do okay with this. But I always think to myself, if I didn't have the level of knowledge that I have, just basically because of the work that I do and the experts that I have access to, I mean, I may have sent you in an ambulance that night,
Totally.
But, I knew you didn't have pneumonia. I knew you would be fine.
I forgot the pneumonia thing. And now I know why, though. It was because of the breathing. And I couldn't breathe. And I was like, I can't breathe.
Yeah.
So, I guess I thought I had that, too. I wasn't rational.
Because they tell you that you have to prevent pneumonia. So you have to be walking around. Right. Don't just sit in the chair all day, etc. So you have that in the back of your mind. I really feel for anyone who is the caregiver during something like this. And, we're relatively young and healthy, but anyone who's dealing with more than that and making sure that you are doing all of the things you need to do, keeping up on the pain, making sure that you're breathing into the thing and going for a little walk, all of that. Like, it's a lot. It's a lot. And not having enough knowledge, I almost feel like they can't possibly tell you everything. Like, it's just impossible for them to be able to prepare you for everything that's going to happen. They do the best that they can. I wonder how many people are calling the next day or the day after.
I disagree. I feel like they do this constantly. It's clear there's this giant body of old knowledge because the hernia surgery has been done so often by so many people for so many years that it's actually outdated. It actually reminds me a lot of stuff with scouting. We have this challenge with scouting. Scouting is, the Boy Scouts of America have been around for so long. Even if you put new information out, there's older information out there. And you should almost fight with yourself about the history of what you already have out there.
Because it just never goes away. It's once you put it out, it's there forever.
And then, and then there's a little bit of don't consult Dr. Google, which my surgeon said. And so I didn't, and I regret that a little bit because there was a lot of gaps in my knowledge that I think if I were to go back, I would have absolutely educated myself more because they really didn't cover this stuff. So I disagree. I think everybody goes through this constantly. They churn these suckers out. It's a common surgery. It's a serious surgery, but it's not that uncommon. I think they can absolutely codify it better. But, shame on me too, right? I'm an adult. I could have done more research. I didn't. So I learned the hard way.
After the break, Mike's recovery process.
All right. So you did take that week off from work. Mm-hmm. You needed it. But let's go through how you sort of progressed. I want to think of it as sort of a week by week because I think it also surprised you as to how long it took for you to get back to where you could go through your work day. And again, with the caveat that you have a desk job and your desk job is literally located inside your own house. So you there was no commute or anything like that. So you took that first week off and then you went back to work the next week. And then what was that week like? And how did you have to take care of yourself?
Yeah, the biggest thing wasn't pain, right? So then after you sort of get through that really bad night, the pain wasn't nearly as much of an issue. Not that there wasn't pain, and not that I couldn't manage it. And as you mentioned, a lot of it's sleeping, right? Just sort of trying to make sure you're taking enough medication before you go to sleep so you can manage that. And I tried to get off the opioids pretty quickly. I think we were done very relatively. We didn't use the full course right away. It wasn't like I was like I needed it every day, and I didn't want to because part of the problem was, of course, you can't focus and try and do the rest of your life. The bigger problem was my stamina was done. I got tired just working. And, again, desk job is not huge, but I really couldn't go more than a couple hours before I basically needed to lay down with a heating pad. And that was surprising because I was physically okay otherwise, I felt, for the most part, but I really just didn't have the stamina. And that sort of went on for weeks. It wasn't sort of, you'll be over it. So even when the pain was less, the stamina still wasn't there. The other thing that happened was I wanted to get back to sort of my physical routine. I could not lift weights for a month, which made sense. But even that was exhausting. So I was certainly losing a lot of sort of progress around my physical routine. I kind of felt that a little bit, but didn't really know it till I got back to it. And that was, again, sort of quite a shock if you're not doing it for weeks at a time. But for that first week, it was just really losing my stamina that was the hardest. I tried to let everybody know, like guys, don't expect a lot from me. And everybody was fine with that. But it was one of those things where as I mentioned, I was in Scouts. So like there was no way I was doing anything in the evenings. There just wasn't. It just wasn't happening at the end. So as I said, what's fascinating when you hit your limits is it's not like, oh, maybe I can push through. There was no pushing through. You're just done. You're done. The end. So, my body told me that I was done. Pretty much, frankly, probably making it to sometime in the afternoon. And that was it for work. That was it for volunteerism. That was it for anything else that I would normally do. So a lot of things got rescheduled without me realizing I was going to have to do that. So I was overly optimistic.
Right. And your healing progressed, as it tends to do, thankfully. But you were finding that you had to change your diet and that things that you were eating, you were reacting to them in a different way. So what was that like?
Yeah. So this is, again, no one mentioned this at all, but it makes sense. You've had surgery. It affects your abdominal wall. A lot of the concern was outwards in, right? Like not going to wear belts, worried about any kind of pressure on my stomach. So, don't want to be doing sit-ups, for example, that stuff. But the reality also is there's an inside out, right? Which is I'm lactose intolerant. So I have to be sensitive to what I eat. And I had some pizza, and that was a very, very painful experience. And it was because there was bloating pushing against the same muscles that were sore from the surgery. So now you're sort of coming at it the other side. And that was interesting because I started to lose weight because I was not interested in eating foods that I normally enjoyed, which continues even to this day. If I overeat, so that's not even bloating. It's bloating, but it's not due to gas or, lactose intolerance. Just eating too much, it hurts. So, boy, that was a shock. And again, no one had ever even a whiff of, you got to be careful what you eat. A, do you have lactose intolerance or anything that would cause bloating? B, don't overeat or eat too much, or frankly, even eat too fast, which is a problem because I eat tremendously fast. And that was a surprise. So that was the other thing was I started to slow down what I ate and be very choosy about what I ate, which I wasn't before because it caused bloating, which caused pain.
Right. So we changed our mealtime routines somewhat once we understood that was the case. And I think you were using the heating pad on and off in the afternoon and then at night to sleep. That probably went on for almost 2 months,
Yes.
I think.
Yes. And true love is that you, my dear, gave me your best heating pad. The biggest and largest.
Yeah. And that speaks to the experience of someone who lives with a chronic illness is that I have several heating pads and one of them is my bestie.
Mm-hmm. And you gave that to me. So you must love me.
Right.
Because that was good. I swear by that heating pad. And then there was a running joke because at one point we looked at the bed and there was heating pads on either side. And you're like, look, it's a his and hers heating pad.
It's a his and hers heating pads.
Yeah, that's pretty funny. But totally. Yeah, absolutely. I needed the heating pad. The heating pad helped tremendously, partially because it just sort of calmed down any kind of muscle pain. And a lot of it was like, it's kind of a weird thing. I was sometimes just happier to stand or lay flat. Because it was just not having my stomach sort of crunched up, which you don't realize how much you do unless you're at a desk job and you're constantly doing that. So the recliner came into play because you could sort of not do either of those, which is tiring or impractical. but sort of still have that and have this heating pad on you. So that worked nicely with the recliner plus heating pad was good. I also did get used to sleeping with the heating pad at night. That's harder for me because then I get overheated and I don't know, it was just challenging. But I needed it sometimes just to go to sleep. So the heating pad was absolutely invaluable. I knew it would be. I mean, that was one of the few things that wasn't a surprise. But it was definitely a life adjustment to having our buddy the heating pad.
All right, Mike, you are now, I think, 8 weeks after your surgery. How are you doing today?
Good. I'm not perfect. I'm still not. So I've heard up to 6 months where you just don't feel anything. I don't necessarily feel pain. I feel tension around the muscles. And always in weird spots. Like it's never like where you think it would be, and it's sort of different places depending on where things are going. For a little while, so I both kickbox, which not with a person with a bag, and I lift weights. I lost a significant amount of strength from that week where I wasn't able to lift, which is fascinating to me. So I'm sort of building that stamina back up. But I use a weight belt, and I didn't before. That helps a lot. So that's sort of just to give sort of stability and feel like you're not going to strain yourself much. But I still have definitely some effects that I feel in my stomach. The other thing was we actually got to talk to the surgeon. So normally the way the recommendation goes is the week after the surgery, you have to see the surgeon so you can be cleared to go back to work. And again, this is old information that's not accurate anymore. Obviously, because it took a month before I was able to see my surgeon. So I had to go back to work without her advice, which was fine. Again, not high stakes because it was remote work. If this had been a situation where I had to commute, I think this would have been a very different conversation with both the surgeon and the hospital and a bunch of other stuff. But we were able to confirm a few things. One was, at least according to her, I didn't do this to myself, which is a little bit of a comfort, right? The concern was I had strained myself in a way that I had made things worse. The other thing that came out, which she said, which I think was really important, was I thought things had gotten worse in between the diagnosis and the surgery, right? And I had noticed when we were out on our global trip that I started to feel on the left side there was a hernia potentially as well. But she said, no, she said, just when I examine you physically, it's imperfect. And so it wasn't a great way to do it. And that's the only real way to know is when we're in there doing the actual surgery. So she sort of made me feel a little better because I was like, what did I do? And and of course the point was, and if that's the case, should I not do that in the future? Right. That was my concern, is what shouldn't I do? What's interesting is there's a lot of you can do whatever you want. Go back to weightlifting, go back to kickboxing, go back to whatever you're exercising. Walking we always have done. And they were like, sure, that's fine. But there really wasn't any sense that was the issue. The other thing that's always fun when you tell people about this, and of course, I got a big mouth, so I tell people about all my personal issues, is how many people will tell you about failed or problematic hernia surgeries, and how these meshes are a real problem. Again, my understanding is that's old mesh. This is sort of bio-friendly mesh. And I have two, right? Because I have the two major hernia points. So it is interesting because just because the state of the hernia surgery has advanced, it's so challenging to navigate and have a conversation that doesn't make you go, oh my God, I'm going to have this problem again. But the feeling, I think, generally is people will have this, right? So I'm a little bit of a cyborg. I actually like to think that my core is better because of this. So in some ways, as I build muscle, I'll actually be stronger for it. And I hope it will improve my life. I think it was worth it. I think I stand by our timing. We did it in September, which was good. If we had done it any later, that would have been terrible. If we had done it any earlier, that would have been a tough summer. So I'm glad, knowing how long it's taken me to get to this point, I'm glad that we picked when we did. But yeah, I'm sort of done with the heating pad. Good old heating pad. He's back to you now. So rehome him. I won't say that. Probably in the mornings, I still will take some kind of over-the-counter meds, depending on how I'm feeling. A lot of times that's just headaches from all the other stuff going on in my life. So I would sometimes take it at lunch as well, but I've really sort of gotten away from taking it otherwise. And, that's good. For all the travails of this, I thought it was definitely worth doing. I think I understand what is involved. I think, unfortunately, the perspective of the patient just gets sort of overrun by this machine of hernia surgeries that's being done. So, but yeah, I feel like, I'm way better than I was, but I believe it. I think it will take 6 months before I don't remember I had hernia surgery.
Right. That sounds right to me. Also based on my experience, which was a very different type of surgery, and I had open surgery. But in the first days after surgery, I thought to myself, how am I ever going to do a sit-up again and not feel like my guts are falling out? So it is really wild, and you do start to feel better very slowly. And then, of course, you just get, you get back to everything that you were doing before, and it's all fine. You just have to give it time. So we didn't have an outline for this episode.
Nope.
I didn't give you any questions beforehand. Nope. We knew we were going to do it, but that was about as far of the discussion as we got. Do you want to talk about sex?
Oh, baby. I love to talk about sex. What do you want to talk about?
I'm trying to remember what we talked to the surgeon about, what the questions were about when you could go back to having sex. And I think the answer was whenever you feel like it, which was also like kind of not an answer.
Yeah, it's sort of, and again, this is one of those things where, and I don't want to make anyone feel bad, but I felt like we're a couple doing pretty good, right? Physically, we are, as I mentioned, we've been married for a while. So, I don't know what people's circumstances are when they come in, but I feel like if people are older, sex is not the top of their mind, essentially. I just don't feel like it comes up very much. So there was a little bit of like...
It might be.
Yeah, I don't know. But I mean, the vibe I got from them, from the surgeon and everybody was like, okay, well, sure. So they just didn't seem like people asked. Now, maybe they don't ask, they're reticent. I don't know. But...
people are reticent, and then they go to the Google machine or they go on the Bookface and ask other people about when they can have sex. So it is always a thing for me that I always like to point out that surgeons really need to be having that conversation with their patients.
Absolutely, yeah. So, but yeah, I mean, and it's so funny because there was also that, like, you're not going to feel like it, buddy. Like, you're like, chill out. You're like, I'm worried about having, and they're like, it's fine because you're not going to feel like it. And I was like, okay, that's a fair conversation, but it took a while to get to that answer too. Like, they're like, oh, whenever you, like you said, the answer is whatever. And again, to me, that's not great. Now, I mean, to be fair, there's positions that make a difference. There's how vigorous you are during sex. There's lots of things that matter. I'll tell you, and I mean, I don't have to tell you, that sort of a few times I was like, okay, well, we paid in pain later for some fun now. And that was just tied to the nature of the hernia surgery. It never really felt like it was stopping me, but it was certainly like, yeah, you were like, I'm going to feel this later. And that's the way it goes, and I don't think that was necessarily wrong in what they said, but there was just like no advice. It was really like, I don't know, that's your problem, bud. Good luck.
Right. Well, for instance, after having baby, I had a nurse after I had my first, and she was very clear in what she said. And she said she had honed this speech over the years. And basically what she said was, don't put anything in your vagina for 4 weeks. Meaning, no penetrative sex, no tampons, no nothing. She said, because if you say don't use a tampon, people think that they can still have penetrative sex. So she just came up with that, and she felt like it covered all of the bases. And I was like, yeah, well, that's okay. That's pretty clear.
Yeah.
Like,
and that's what I asked
now I understand.
For. I mean, I have this conversation over and over. I was like, and we had a couples massage, and we talk about massages, and I was like, I'm going to treat you like my doc. Be very clear on when I can take underwear off. I want to be super, super clear on how naked I get. Because that is important for you, and it's important for me to know. And it's funny because sometimes people are, even doctors are very, like my doc now just knows, right? But it's very like we dance around it, or we don't want to say it up front. And I'm like, no, I want to be very clear for me and for you as to what I need to do, because it's very important to me that I know when to do that. And I feel like this was the same. And again, we got a lot of that, right? When can I work out? Well, it was sort of on the same spectrum. It's just a different workout, I suppose. And we didn't get a very clear answer. It was whatever you feel like. Now, what's interesting that I read a lot, and, again, the Google machine is not necessarily to be trusted in any way, shape, or form, is people were like, you're actually not going to hurt the mesh, right? So that was one of the other questions was, what is the real concern? And the real concern isn't the mesh. They were like, the mesh is good. Your pain level might not be good. The mesh is not the problem. But it was never put to me that way. It was a very vague, creeping, like, sense of doom on everything. And you just didn't know what your limits were.
You're so dramatic. You're so dramatic. It's hilarious.
That makes for good podcasting. But yeah, that's me, you know, where I was like, I need to be really clear on what things are. And then if you don't answer me, I get really anxious. Like, why are you? Then I'm like,
well,
why
you
not?
wanted like time frames. Yeah. Like, you know, and when I had my surgeries, I was given time frames. Don't do this for this amount of time. Don't do this for that amount of time. I did have to ask, when can I have sex again? You know, I did have to because it wasn't brought up, you know, and that started me on the journey of, you know, recognizing that difficulty in patient-physician conversations and relationships.
Totally.
So then it's always a question that I ask and that I tell other people to ask about. Because, you know, they'll tell you don't vacuum. You know? Like, don't vacuum for whatever.
Like, I don't give a crap about vacuuming, dude.
I don't care about vacuuming.
Like, let's be clear what I really care about. But I mean, this is my point, right? There was just such a fascinating, this sort of gap between what I cared about and what sort of and I wouldn't even say my surgeon, because I thought she was lovely. It was more the hospital cared about, right? Just the apparatus.
No, everybody was amazing from start to finish.
They really
everybody was
were
amazing
very nice.
It's
just, I was like, I just need you guys to care about what I care about.
Well, understand what you care about.
Right.
You know, and what you cared about, frankly, was getting back to lifting weights and having sex. That's what you cared about.
Exactly right.
You know?
I don't know what that says about me. I sound like a teenager. I'm not really sure, but yes, that is exactly, because you're right. That was basically, and it's funny because I feel like I brought that question up probably 3 times, at least twice in your presence, and probably separately multiple times after that, and I couldn't get like a straight answer.
Right. Well, I mean, we figured it out. It was funny because you had gone into the gym that's in our house, and I was like, what are you doing? Like, the next week, you were down there punching stuff. And I was like, well, I guess we'll see how it goes, you know, and it went okay. You didn't have too much pain afterwards, although I think that you did modify things as you went along, because you had days when you realized that you overdid it and that you had to scale back. And I also think we were back to having sex within like a week, I feel like. And it was kind of like, let's try it and see. And it was like, okay, well, you might need some more acetaminophen or something like that afterward. But it was surprisingly, it really, and this might go back to their point of do it when you feel that you can, is because we were actually surprised at how quickly you could get back to certain activities. And you may have been a little sore, but generally you were fine.
Yeah, and this was the whole, I mean, it sort of pivoted on the opioid discussion, which was really what sort of got my back up, right? Which was, I want the choice with pain meds so I can choose not to take them, because I know myself and I know that I'm going to go at the pace that I feel comfortable. And certainly part of that, the guy who wants to do weightlifting and have sex is not the guy who wants to be on opioids all week. And their response is like, no, we'll let you know how much you're allowed to have. And so it's sort of, that is where this collides, these two philosophies, which is really where it started to aggravate me, because I was a little bit like, hold up, you're going to do the surgery. The rest of it's going to be me, because you've given up in some ways any right to care since you're not keeping me in the hospital. And as you said, I feel like maybe we should have done that at least one day.
Again with the drama.
Yes. So.
Oh, so funny. It's just so different going through this with you, having gone through all of the experiences that I've had in my life, because I take, I guess, certain things as they come for granted, whatever, and you resist.
Oh, I want to fight all the way through the whole process. and I think I have a very strong sense of an expectation. And again, look, I've been around, I've been in the business world for over 2 decades. So there's certain things I expect, because I know, the stakes are pretty high. It involves my personal health. So I'm used to asking questions and having people engage in good faith. And there was a lot of like, it wasn't bad faith, but there was just a lot of like, why are you even asking this question thing? And you're like, why am I even having to ask the question?
Well, because you haven't done this before. So it's like, I'm going to ask all of the questions because I've never been through this.
And that's
before,
my point. I can't be the only
one.
one.
And I haven't either. And I haven't been through it in this way. Obviously, I know plenty of people who've had hernia surgeries and have interviewed plenty of people, but I've not been the caregiver.
Right.
So, and I knew how much pain that certain people were in after and was described to me when I was interviewing them. So that did concern me. But overall, except for that second night into the third day, things were pretty manageable, I think overall.
Think so.
Okay.
Up next, tips on how to prepare for surgery.
All right, let's try to end this with some tips. Again, did not script this at all or come up with anything. So let's see if we could come up between the two of us with 5 tips for how to prepare and deal with having hernia surgery.
Okay. So, yeah, I mean, I think the first thing is you need a caregiver who is going to be able to take the time to monitor you. I mean, I to your point, I worry about people by themselves. I mean, I know there are people who do this, I guess. And I worry about people with their jobs, right? Like, depending on the job that you have to be very clear about what you physically are going to be doing and then who's going to be around to take care of you in those probably critical 2-3 days. So having a plan, I think, is huge with a person that you trust who can do that. And we're not talking just drive you home, right? Which is what they're like, you got somebody to drive you home? Yes. And, I get an Uber and go home. That's not it. So I think having somebody you trust for sure is the first one. The second one was the recliner. The recliner is really important, which is, the nature of the surgery was your stomach, your abdomen. You cannot, sometimes laying flat is good. Sometimes standing is good. Sometimes sort of, but sort of crouching is never great. And of course, depending on the nature of just eating or whatever you're doing, that's the thing. So I think,
or maybe if you don't have a recliner, an adjustable
Correct.
bed. If you don't have an adjustable bed, maybe pillows that are made for that purpose of propping up sort of your head and your chest, and then also keeping your legs elevated.
Absolutely. And we did that at one point. The recliner, actually, the worst night I had like some bizarro pillow contraption just to keep my feet up. And I don't even understand what I did by the end of it, but it worked. So for sure, making sure you have some means of elevating as you need, adjustable, right? I think that makes sense.
Right.
You mentioned it, having a heating pad and understanding where that's going to be. And it's, again, the heating pad that you have that's amazing is big. And that was good because sometimes the pain was behind in my back. Again, not because it's referred pain, but having that, or, maybe I'm just crouching and different muscles are sort of trying to make up for the pain in my stomach. So the heating pad made a big, big difference. And again, like, I don't think they ever mentioned that you should have one, but man, I couldn't imagine life without it. I mean, I know you're used to preaching to the choir, like, yeah, really? The one that you took from me?
Yeah, that's why I have so many heating pads, and they all have a different purpose. All right, that was 3. What would be number 4?
Well, the big thing that came up with number 4 was eating. Be sensitive to the fact that if you have any kind of bloating or you're a fast eater or you tend to overeat, so you're going to have to watch what you eat. And that was surprising to me because totally out of left field, never considered it, but it was enough to make me lose my appetite, which is sad when I can't look at pizza and enjoy it, or ice cream, both of which I enjoy very much. So I can now, although I take lactate and a bunch of other stuff just to try and make sure, to minimize the bloating, but prepare for that. That's a thing, you may need to change your diet, which.
Right. And not consume gassy foods, spicy foods. You may need to just be cool for a little bit on what you're eating.
Absolutely. And then, so for the 5th one, I think it's probably, really have a plan around your sort of physical activity. I mean, one of the things they push for a lot is obviously breathing and breathing. So the lung capacity thing is tied to exercise too, which is sort of interesting, right? So once I was able to exercise, the lung capacity issue was much less of a problem, but it was freaking me out. Where the first week I really just didn't move, and I just couldn't breathe right. I just couldn't do it. So that was tremendous. And of course, they wanted you to walk. So the physical routine of walking, which we do anyway, which was great. So it was relatively, it wasn't like a weird thing or we had to find a new route. We were ready to do that from day one, just because we exercise, which together, actually, we take walks, which I thought was fantastic, and made it easier. But there's people, I'm sure, who probably don't walk at all and have these surgeries and are like, what do you mean I got to get up and walk? And then they're really struggling.
Well, that's a good point, though, is that if you are planning a surgery like this, that maybe consider increasing your physical activity for a while. They call that prehabbing. You know, if no one is going to, if you're not going to get a plan and you're not going to see a healthcare provider that's going to specifically put you through some sort of a prehab regimen, maybe doing it yourself, increasing your activity so that you can get back to walking right away.
Absolutely. And then, of course, as you said, I had done other exercises and I had to adjust them. So kickboxing was no kicking, just the boxing. My weightlifting was not on the table for a little bit, but I would also do, as you mentioned, sit-ups, no sit-ups. I have a weighted hammer I use, couldn't use some of that and some of the lifting. So, certainly adjusted my routine. But what I was able to do certainly, I think, helped a lot. It was good for my mental situation because I was getting really frustrated sitting around. But it was also good sort of for, I think, the muscles in general. And then, I had gotten that weight belt, which I swear by. I wasn't sure if I was going to use it, and I use it even now. I still use it. So it was really modifying, great if you haven't done the exercising, for sure, having a plan, but then even afterwards, sort of having a staged plan to sort of recover, because you're going to be under, this is major surgery, and you're not going to be able to do as much as you did, and you're going to have to get back to it. I take that as a challenge. I'm sort of making that my New Year's resolution to sort of try and get some of that stamina and muscle back, but it'll come. It's a shift. If you think you're just going to go right back to whatever you were doing, you won't. And you need to be patient with yourself and the circumstances. But again, if you can adjust your routine and frankly plan your routine, I think it's really helpful. Otherwise, it's very frustrating go from one thing, you go under surgery, and then a month later, you're like, I can't lift what I was doing or do what I was doing before because I get tired or I've lost the ability to carry and lift the same amount of weight. So for sure, prepping that way, setting your expectations, and having a staged plan, I think, is valuable.
Right. Yeah, it is very difficult to go into surgery feeling well and come out of it feeling worse than you did when you went in. And it is challenging because you just want to get right back to everything. So, but you have to make a plan and stick to the plan, and it should work out.
How was that? 5? We just made those up.
That was good. That was 5. Okay? We made it to 5. Yeah, I think so. I think we did it. Anything else you want to add?
I'm going to take this. Uh-oh. Nobody can see this if you're just listening, but you.
Yeah, if you're listening to the audio version.
This for me. Sewed this? What is this called? This cross-stitched it for me.
So for those that are not seeing a video, Mike is holding up a cross-stitch that I made him some years ago. And it reads, "What does not kill me gives me XP." And XP refers to experience, and that's in terms of, as Mike mentioned, he's a gamer. Really, Dungeons and Dragons is, as I think, where most people's might be familiar with XP. So
I think it applies.
That's it does apply.
In the most dramatic fashion possible from my side, but yes, I think it applies.
Well, I always say, I don't want people to experience too much adversity. I'd prefer a little bit of adversity is helpful and helps you, build character and help you understand who you are and what you want out of your life. You don't want to have too much adversity and have it hold you back from the things that you want to do. But for sure, it didn't kill you. You now have some XP. You were able to come on my show again and give this experience that anyone else that is going to undergo or is thinking about undergoing or is maybe putting it off a little bit because they don't want to have another surgery, and that I totally understand. But having robotic hernia surgery, in your case, you came out with, it was good that it was done when it was, because there were 2 large hernias that we weren't really aware of the size of them until your surgeon got in there. And then you were able to come through it and are doing well just even 2 months afterwards.
That's right. Yep. So I got experience, and I get to share the experience with all of you. So that hopefully makes it worth it for everybody. I feel like it was worth it. To your point, it was definitely more serious. I don't want to make it sound more dire, but it was more serious than we expected. And that's going to pay dividends down the road. So I'm glad we did it now.
Right. Thanks for getting in front of the microphone once again to help me out and put out another episode of this show with your voice. So
thanks for
Mike.
having me. Hopefully this is 4th time. 5th time's a charm. Maybe I'll come back again for something else.
I mean, I'd prefer that you not have another procedure that we can go through. I mean, who knows? There's far more things also that we could discuss that go just because of the nature of the being a well spouse and the spouse with chronic illness. I think we could probably do a limited series. Maybe we should think about that. I don't know.
See the thoughts. We've got other podcasters still trying to figure out, but sure, yeah.
I know, but there's so much to go through and to help people understand about how to navigate these things. Not that we've done it perfectly, but I think coming up on our 25th wedding anniversary, we could probably say that we are qualified to give a certain amount of advice in any case. Okay. All right. Well, thanks so much. And we'll close it out here.
Thanks, everybody.
Hey, super listener. Thanks to Mike for recording with me and being so honest about his surgery and the recovery process. We hope it takes away some of the mystery about having this type of surgery and gives an idea of how to prepare and what the recovery process might be like. As always, links to a written transcript, everyone's social media handles, and more information on the topics we discussed is in the show notes and on my episode 166 page on aboutibd.com. Thanks for listening, and remember, until next time, I want you to know more about IBD. About IBD is a production of Mal and Tal Enterprises. It is written, edited, produced, and directed by me, Amber Tresca. Mix and sound design is by Mac Cooney. Theme music is from Cooney Studio.